Good morning. I'm Linda Ziegler. I'm the co-director of the Women and Family Health Program at Penobscot Bay Medical Center. And I've been working in the field of...
Right. And I'm Holly Miller, Director of Grant Funding for Penn Bay Healthcare.
Go ahead.
Oh, I'm Don Grost. I'm the administrator at the Knox Center for Long-Term Care in Rockland.
I've been working in the field of women's health as a nurse for the last 30 years. First in the area of maternal child health, and since 1993 in women's health community education. And as the director of the Women and Family Health Program, our mission is to provide or build resources that address the needs of women and their families with a focus on prevention through education and family learning opportunities. I appreciate this time speaking with you this morning about the Rural and Island Health Initiative for Women and Families. I've been out to the islands in Penobscot Bay, down the peninsulas, and all the little towns that serve our area over the years, gathering in church basements and schools and community centers and people's homes, talking to women and girls about their health. I've listened to the stories and learned about their lives, and one thing I've learned is that we need to do more for rural women in the 1st District. In rural areas like Mid-Coast Maine and the island, women are falling into a healthcare gap, particularly in the areas of specialty care for women that are of childbearing age and women that have gynecological problems. We know that there is a delayed start to prenatal care in rural women, that more women under the age of 20 and over the age of 40 have pregnancies. There's more maternal smoking in rural areas. There's also, in rural areas, more cancers that are diagnosed at later stages than urban areas, and that includes breast and cervical cancer. The lack of oral care for rural women is a problem, and especially it's a prenatal problem because if they're at increased risk for periodontal disease, they're at increased risk for preterm births. More rural residents suffer from chronic diseases. Women between the ages of 45 and 65 die from diabetes more commonly than other people in the population. And women 55 to 65 often are at higher risk for chronic diseases, and they are close to retirement, they lose their insurance, and the lack of health information puts them at increased risk for being able to manage the risk factors. Transportation, child care, a place to stay far from home, that's an issue. All of these things, including lack of access to mental health services and addiction services, sort of define the problem areas for access in rural health needs. Now, Penn Bay has applied along with the healthcare providers on North Haven, Vinyl Haven, Manhegan, Matinicus, and Islesboro for a planning grant to help identify some of the ways the hospital can support the needs for islanders. Part of this is to create more linkage between primary care and specialty care, and in addition to provide some education on administrative services and clinical issues. As the director of the Women's Health Program, we're really wholeheartedly supporting the Island and Rural Initiative. When we receive the responses through our planning network on the islands and at the hospital, we'll build programs and services and outreach linkages that will help address the needs of women in family health care. So thank you.
Thank you.